Healthful Day. I'm Dr. Joshua Twassen of Cebu Doc Group. Today, we will give answers to your questions about vaccines, getting vaccinated, and what to do before, during, and after you get your vaccine. Vaccines are tiny, weakened, non-dangerous fragments of a pathogen, the germ that causes a disease. Some vaccines contain only a part of the disease germ or genetic product that creates protein copies. They have either been killed or weakened to the point where they can't make you sick. Vaccines differ in their composition and how they trigger the immune response to create antibodies. Antibodies protect the body from infectious microorganisms. That way, if and when your body encounters the real pathogen in the future, it already knows how to spot and fight off the pathogen before it can cause disease. Vaccines guarantee protection from germ-causing diseases. Along with the observance of minimum public health protocols, it is an important way to protect you from having severe COVID-19 disease. Getting vaccinated will help all of our efforts in putting an end to this pandemic. Vaccines that are granted Emergency Use Authorization, or EUA, by the Food and Drug Administration are considered safe and effective based on the available evidence we have to date. Like all vaccines, there are possible side effects. Pain, redness, itchiness, swelling at the injection site can occur and may last a few hours. Some may experience fever, feeling of weakness or fatigue, headaches, dizziness, diarrhea, or nausea. But these are normal signs that your body is building protection. So if you experience any of these, inform your healthcare provider immediately. No, you are not. However, we are highly encouraging everyone to get vaccinated to protect yourself from getting severe COVID-19. See, if 70 to 90% of the population can get vaccinated at the soonest possible time, we can achieve herd immunity, which will help protect the other members of society. That way, hopefully, we can get back to pre-pandemic normalcy. The FDA and DOH have different recommendations for different vaccines. Your age group, immunity response, and presence of underlying conditions are considered and assessed before you can get vaccinated. Pregnant women can be vaccinated once it is available to them. There is currently no evidence that antibodies formed from COVID-19 vaccines cause problems during pregnancy. However, you need to discuss this with your OB/GYN and secure clearance. Our national government has set the order of prioritization in the rollout of vaccination. Among them are frontline health workers and uniformed personnel who have a higher risk of exposure while on duty. Getting vaccinated will allow them to continue fulfilling their duties in the public and private sector. Vulnerable groups, such as the elderly and indigent population, are prioritized on the principle of equity. The cost of vaccines for the priority groups will be shouldered by the national government. The government is continuing negotiations to ensure adequate vaccine supply for all Filipinos, including those not in the priority groups. The procurement and administration of vaccines is controlled by the authorities.
Hi, I'm Dr. Karen Woolbright of Cebu Doc Group. And now that we're acquainted with vaccines, let's take a look at this overview of the vaccination process. Getting your COVID-19 vaccine is easy and relatively hassle-free. Once you get a confirmed appointment, proceed to the assigned vaccination center. You are required to wear a mask, a face shield, and follow public health protocols at all times. At the screening and registration area, you will be asked to fill out a health declaration form and sign an informed consent. Once registered, you will be required to watch a vaccination orientation video while your vital signs will also be taken. After this, a resident doctor will conduct a health assessment if you are qualified and fit to receive the COVID-19 vaccine. If eligible, you will then proceed to the vaccination area. After receiving your first dose, you will be given your vaccination record, which indicates vaccine used, date of vaccination, and date for the next dose. You will then be required to stay at the premises for 30 minutes for post-vaccination monitoring. This is to observe if you present with side effects or any unusual reactions from the vaccine. Here, your vital signs will be monitored and recorded. Any symptoms will be immediately referred to the resident doctor and healthcare staff. The last step will be post-vaccination documentation, where your vaccination record will be archived. You will be given post-vaccination instructions here. And you're done! You've just made a great choice to protect yourself from COVID-19. After being vaccinated, monitor yourself for any symptoms and side effects. Should you experience any unusual symptoms, contact your physician immediately or contact these numbers. Make sure to remember the scheduled date of your vaccine's second dose.
Like all vaccines, COVID-19 vaccines can pose potential risks. However, severe or life-threatening reactions are extremely rare. The benefits far outweigh the risks. Remember that the pandemic is also a race against time. If access to a COVID-19 vaccine is available to you, trust that it works.
Remember that vaccines may only be administered in authorized vaccination centers such as Sibudok. Unauthorized distribution of COVID-19 vaccines is illegal until a full market authorization is issued by the FDA.
Verified information surrounding vaccines can be found in resources from the Department of Health, World Health Organization, and the Philippine Information Agency. Always fact-check what you read about vaccines. Join us in the fight against COVID-19 by being vaccinated as soon as it becomes available to you.
Vaccines are safe and effective, so get vaccinated and let the community healing begin.
Vaccines work. Get vaccinated and let us heal as one.